Hey guys, my name is Autumn Mast and I'm a physician assistant here at Family and Aesthetic Medical Centers, and I'm joined here with Dr. Coulter.
Hi guys, I'm Dr. Coulter here at Family and Aesthetics Medical Centers.
This month we're going to be talking about breast cancer because it is October, so we're going to go through all the different types of breast cancer and also what we can do to make sure that people are being screened, what symptoms to look for, and what we can think about for treatment too.
So since this is October and it's Breast Cancer Awareness Month, we always want to talk about why this is so important. And one of the staggering statistics is that 1 in every 8 American women will develop breast cancer in their lifetime. And so because it's so common, we really want to get the word out, and we want women to start thinking about making sure that they do their normal breast cancer screening. So Autumn, when should they actually start screening for breast cancer?
So what we typically say is all women at the age of 40 should start to have a screening mammogram. But like all things in medicine, that kind of does vary, because if you have a family history where, for example, a mother or a sister has breast cancer at a younger age, we're probably going to screen you at a younger age just to make sure that you're safe up until that age, and honestly up until you're about 75, right? Yeah. And so it just kind of depends on your own family history and what you have in your genetic pool too.
Yeah, and one of those really important genetic tests is the BRCA test, right? So there's BRCA genes that some people are born with, and that increases their risk for breast cancer. So you can actually get screened for that genetic test, especially if breast cancer runs in your family. So it's really important to ask your doctors about that particular screening, and then knowing that you will start, like Autumn said, at 40. And so you want to make sure that at that point in time you come in, but if BRCA runs in your family or you have that gene, you'll start much earlier. And then, so how are women tested for breast cancer? What kind of test do we do?
Yeah, so as long as it's a yearly normal screening where you come in at starting at 40 and we just check you every single year, we do something called a screening mammogram. The reason why we start this at 40 is because it's almost a little bit like an x-ray, but whenever we're young, our breast tissue is still dense. And so if we try to do that whenever people are, for example, 20, 30, usually their breasts are still too dense, so we won't get too many answers. And whenever these guidelines were made up, and they're continually changed too, depending on statistics, but we keep it at 40 because that's like the usual age that we start to see things pop up. So that would be a screening mammogram where we basically smush the breast, and then we try and take almost like an x-ray through it to see if there's any lumps or bumps or anything to be worried about.
Yeah. And then we are partnering with the Rose on October 13th. And so that is an organization that offers mammograms. We are actually bringing that here to our patients in Pearland. They'll have a day where they can come out, they'll get their mammograms done with the Rose. They actually leave with a rose, and we'll have some little mimosas. And this is a way to really get the word out, get people thinking and talking about breast cancer awareness, especially during this month of October. But not only do we want to make sure that screening and people are aware of that, but also know that if you are diagnosed with breast cancer, this is not the end. There's actual treatment as well. And that can consist of whether it's surgery, chemo, radiation, hormone treatments. It can be a myriad of things depending on the stage of the breast cancer when it's found. And then we would refer you to a breast specialist from that perspective so they can talk to you about your treatment options. So know that there are survivors. And then because of these treatment modalities and detecting breast cancer early, there's a really high chance of you becoming a survivor if you are diagnosed with breast cancer.
No, I completely agree. I think that we have done a pretty good job at making sure people think about their screening mammograms every single year, but that's about 365 days in between them. So what kind of symptoms would you tell your patients to come in for if they're experiencing, but for example, they just had their mammogram done like 3 months ago, so they're like, I'll just wait to the next one?
No, never wait. If you notice that there is something different about your breast, you definitely want to come in. So some things you want to look for is if you actually feel a lump in your breast. You should never feel a lump in that breast. So you want to make sure that you know how your breasts feel, which is why doing your monthly breast exam is really important, because if something changes, you can pick it up. So lumps or growths are really important for you to detect. And if you do notice something, come in as soon as you can. If the skin on your breast changes, so you start to notice there's a dimple in the skin, or it starts to get thick and like there's something called pude orange. It literally looks like the outside of an orange peel, the way your skin looks, then you want to come in for that. If you notice a discharge from your breast, especially a bloody tinged discharge, that can be concerning for breast cancer as well. So if you notice anything that just doesn't seem right to you, you want to make sure you come in and be tested. Do not wait just because you just had a mammogram. You still want to come in, and it's better to be safer than sorry.
So if y'all have any other questions or any other concerns, go ahead and come in and schedule an appointment with us here at Family and Aesthetics. We love to talk about anything breast cancer related, or if you're due for your yearly screening, just come on in.